Good morning, everybody. I also want to acknowledge that we're on the land of the Wurundjeri people of the Kulin Nation, acknowledge elders in the room, elders past and present, and elders from other cultures. And I also want to say thank you for coming because with the coronavirus, it's a really uncertain time. So I want to say thank you for being here. I know that there are lots of people this morning at briefings about what the implications are for service delivery here in Victoria. So I want to say thank you for making the time. I'm really pleased to present today. I don't always present. I normally do what Kathy's doing, which is to MC. So today I get to talk about a little bit of content and a bit of detail. Much of that's come from you in some work that we've done with you. So I'm very pleased today to present on the topic of finding common ground in how we talk about, respond to and support young people who use violence in the home. Up until now, there have been some differences in the way that we think about adolescents who use violence in the home. Some professionals have seen these young people primarily through the lens of family violence as perpetrators. Other professionals have seen the adolescents primarily through a trauma lens with a focus on the child. So today is about moving forward. It's not about solving things. I mean, as Kathy said, there's just so much information out there that we need to consider. It's a lot more to learn, but lots of information. But looking at a common language, an agreement on the need for evidence-informed practices and evidence-based models that are proven to work with adolescents or show great promise in doing so. And this is a practice forum. I have to remind ourselves it's about what works. So I thought it might be worth, just for those who don't know who we are, just to sort of remind you. In terms of our work, many hundreds of organisations are our members. We do lots of policy and advocacy. Recently, I think Kelly's here, we've got a standing committee that works on some of our Commonwealth policy areas called Treating Families Fairly. We do lots of strategic projects. We've got a project called Tri-Peaks, which is ourselves, Victorian Health Association and the Victorian Alcohol and Drug Association working together. We're an RTO. And as Annette said, the delightful Annette, I was very grateful. She talked about open, which is really the cornerstone of our research to practice work at the centre. I think our open portal's got 900 worker subscribers, and it's where we put all the useful information about translating research into practice. So have a look at it when you get time. So we're really pleased to be doing this with Family Safety Victoria, and I know that I felt that the opening address that Annette gave this morning really helped us frame what we're here to do today, but also the commitment that Annette and her colleague has to adolescent violence in the home. And I have to say, they've been right behind this forum and wanting to make this happen, and I'm sure there'll be others in the future. I might just move on, because there's a lot to get through. So in terms of today's event, I just really want to recap. I know Kathy gave some opening remarks, but I just want to be really, really clear about why we're here. It really is about an opportunity to recognise the different drivers of adolescent violence in the home, and that our responses need to be more nuanced in recognition of these differences. And many of my research colleagues here today who know this stuff better than me have done a brilliant job of that. For example, and this was also said just before, a young person with a disability who uses violence through being frustrated, not being able to make themselves well understood, from a young person who we know they exist, exercise control and have witnessed gender violence, are quite different things. I know you know this. So today is about identifying how we can intervene earlier in the life of a child. We've heard before, we've got to start 10 years earlier, and their family to provide the earliest possible support and prevent a cycle of intergenerational violence. It's about making sure any professional, and that's you in the room, and many others, who comes in contact with an adolescent who uses violence in the home is able to respond appropriately, drawing on the best available evidence. And if I had Dean McWhirter here from VicPol, he would say this is one of the most significant things that police are dealing with every day. It's a huge issue. And not to put too fine a point on it, armed with this knowledge, we need to be able to work with young people who use a range of behaviours that are highly concerning. We shouldn't gloss over it. They're highly concerning for all of us, cause considerable harm to others, and which are frightening and unsafe while responding to children requiring our care and protection. So as a peak body, we have to balance what is really going on here. And some of this is very concerning. Can also be confronting when older, possibly more adult-grown children are violent towards their mothers or parents or a sibling. But as workers, we are coming to recognise they are still children, even when engaging and mimicking and playing out adult-like behaviour, and therefore our responses need to be different from that we use for adult perpetrators. And as workers, I know you know this, you work in homes, you work with these kids every day. So today is about recognising that despite the nature and severity of these behaviours, adolescents are still children. And I still have adolescent children, and they are still children. And any approach that needs to consider this is young people's developmental needs, including their safety, stability, and well-being. Oh dear. Okay, so we also did a survey. It feels like you're going to be darted out here today. I do apologise. But look, from the work that we've been doing with Family Safety Victoria, we felt that it was also really important to talk to the workforce. Now, when I mean the workforce, I mean workers who are working in family violence settings and workers who are working in family services. And it won't surprise you that most of this data really aligns with my research colleagues who've presented before. But I think it will be interesting for you, those of you in the room, because some of you will have participated in this survey. So the survey, it was cross-sector, as I said. It targeted the family violence and integrated family services workforces. It mainly asked about existing tools, programs and knowledge gaps. And actually we had 570 responses, didn't we, Carolyn? So a really good response turnout. This was interesting. So this is about language, and I know you all of you in the room know that we use a range of language when we describe adolescent violence in the home. So this is some of the language that was used. So broadly, the survey responses fell into the following categories: adolescents who use violence, perpetrators, also called offenders, respondents, or primary aggressors. The survey showed these terms are being used interchangeably. Victim survivors, other words used here included traumatised, troubled, these kids that need help. Young person with, and then a range of words were used to describe their behaviours, words like disrespectful, concerning, externalising, aggressive, unsafe, harmful, difficult, dysregulated, naughty, heightened, disassociating, forceful behaviours. It's really important, isn't it, like to hear that. What are people saying about young people who use violence in the home? But overall, interestingly, there was no real significant difference between the sectors. The survey showed the common ground that exists between these two main workforces are that they're using similar rates of terms like adolescents using violence and perpetrators. The only significant difference was that child family services were more likely to describe the young person according to their behaviours, whereas our family violence colleagues were more likely to use victim survivor terminology. Many comments indicated workers were passionate about, were passionate about avoiding labelling the young people they worked with as perpetrators. A number of respondents reported that their organisations are moving away from perpetrator language to adolescents using violence. And the use of the word adolescent, doesn't it? It reminds us that we're working with children who are at times engaging in unsafe and concerning behaviours. So now I might move to what we found as the characteristics of Victorian adolescents using violence in the home. These survey findings represented workers' views about the frequency or otherwise of particular behaviours and characteristics of young people who use violence in the home. It's important to capture the perspectives of professionals working day to day with adolescents who use violence in the home. And so these are some of the common characteristics. And again, I'm hoping that none of this is a surprise to you, but it's always nice for there to be a bit of data that does surprise you. Respondents, that is the workers, reported that the violence was most likely involved adolescents who were 13 to 15 years of age. Does that resonate for those of you who are in the room? Yeah, it resonates. This was followed by 16 to 18-year-olds and then 10 to 12-year-old children. The survey showed no alignment with particular cultural groups. Now, there's a lot more work to do there in terms of what particular cultural groups need in terms of responses, but there was nothing that jumped out in the survey in terms of that alignment. But 88% of respondents reported that it is frequently or very frequently the case that the mother is targeted. Again, that came up in the research prior to my presentation. And workers did report that fathers and other family members were rarely or occasionally targeted in terms of the violence. So this is some further data. And really, there is still a lot of work to do on what we mean by trauma, because we use the word a lot. We'll use the word a lot here today, but I still think we really need to define a bit more by what we mean, what the child is saying, what the parent is saying about the nature of trauma, and also the worker. But 93% of respondents reported that is frequently or very frequently the case that a young person has a known background of trauma. Now, that can be anything really in terms of the impact. However, this, as I said, was not defined in the survey, and we really need to be careful about interpreting that because it's a very personal thing, your relationship to trauma and what that might be. Many children experience multiple traumas, as we know, which can impair their development, including attachment difficulties, problems with behaviour regulation, affect regulation and maturation. However, the extent to which trauma influences future family violence is not yet known, not the exact link. Research does suggest that this complex context requires, as I said, therapeutic, trauma-informed interventions with both the child and the parent, including supporting parental skill building. So this is another common characteristic about where we asked respondents about young people as victim survivors. It would not surprise you to hear that 86% of respondents indicated that it was frequently or very frequently the case that the young person has a background of family violence. Now, that is not surprising given the rich research we've seen this morning. Nearly half of the survey respondents indicated it was frequently the case that the young person was still in touch, perhaps living with, the person who had perpetrated the family violence. This is a sobering statistic, as we know from the research that exposure to family violence in childhood can inhibit healthy cognitive development and contribute to hypervigilance, excessive aggression, poor emotional control, and increased risk of developing substance abuse issues. It can also, as we've heard, shape negative or derogatory views of women and misconceptions of what constitutes healthy relationships. Again, this won't surprise you. It lines up with what you've heard this morning. A high proportion of respondents indicated the presence of intellectual disability in young people they worked with who use violence in the home. More than 1/3 indicated that the young people using violence had an intellectual disability, and that's a very big number. And around 42% of respondents indicated that it was frequently or very frequently the case that the young person had autism spectrum disorder or was on that autism spectrum. This context does not focus on any purported link between young people using violent behaviour and specific disabilities, but the prevalence is a thing of concern. The prevalence, and then what do we do? What is our appropriate response is where we need to focus. We know that without adequate supports, it's possible that children with intellectual disabilities are more likely to develop externalising behaviour problems that peers without disabilities do not always have. Violent behaviour exhibited by young people with disabilities may be a way of externalising frustration without the intent. Must say, makes me think about the National Disability Insurance Scheme, and particularly the perhaps lack of support that many of the mothers that were described earlier are finding it difficult to access, and the service system has become much more complex for these mothers than it might have been even a few years ago. Okay, in terms of alcohol and other drug, this slide is not included to draw conclusions about correlations between substance abuse issues and violence. However, this characteristic should be taken into account when considering appropriate models of care or exploring additional referrals to support the young person. And as we heard earlier, YSAS do an incredible job in this space. So there are some really great drug and alcohol services that are more and more gaining the skills and capabilities around helping to address some of the violence that both these young people are experiencing and exhibiting. Intervention with adolescents should ideally occur concurrently with interventions with parents and carers, and there are some models out there that are showing great success. It is important that interventions with adolescents addresses the intersecting issues that may be impacting their use of violence, not just their drug and alcohol issues. Okay, care and other services. In terms of this characteristic, what we discovered was that 75% of respondents indicated frequently or very frequently the case that young person is known to child protection, and wouldn't be a surprise to those of you who work in that space. However, when asked if the young person was currently on a child protection order, 70% of the respondents said it was occasionally or rarely the case. So they might be known over the years, but are not on an order necessarily. Responses indicated that referrals from child protection were slightly higher than other sources. But more than 26% of respondents indicated that young people they worked with who use violence in the home frequently or very frequently are involved in the youth justice system. And at the earlier presentation this morning around the work in that space is really important. And, we see high rates of criminalisation of children in care, high rates. With an incredible rap sheet when they're very young. So that conversation about how we use our criminal justice system, policing in a really judicious way is very important, because before we know it, we've created another set of problems. Now, this next slide is the one that really, I suppose, really shocked us out of all of the data. So around 80% of respondents reported that young people are either occasionally or rarely involved in school. So this is hundreds of workers telling us about their caseloads, and what those workers are saying that most of the kids that they work with in their caseload are not going to school. And that is sort of devastating, because it isn't just about how do we work with kids around their behaviour, but this is an absolutely life-inhibiting bit of data, and sad. And I think that when we went through this last night, I think that was a thing that, even though Michelle and Carolyn, who'd worked on this, presented it to me, it's still shocking to them, and they've had this data for a few weeks. So it is very concerning. Be interesting when you get into the break to see if it sort of stacks up in terms of your own experience in your work on a day-to-day basis. So, in conclusion, these are insights. They're your insights. Many of you who would have been involved in this survey, they're important insights because this is very recent data, and we're very grateful that you participated in it. They do emphasise the diversity of young people. Their stories are always very different, but we do have some high-level data that says where we might start. But it is a very multifaceted issue, as has been said today. The balance of therapeutic work, trauma-informed, safety and risk. I think Annette said this earlier, safety and risk, very, very tricky space to work in. But that we actually do need to think about now how we're going to embed the things we know work across the system, across policing, across health, across education, across child protection, across family violence and child, youth and families, because actually it's a joint responsibility. The thing that we haven't touched on today that I want to say is that actually, one of the things that's very, very important, I think, in this space is giving voice back to women, to mothers, but also to the kids. Because what came up for me today was, in a lot of the research I heard, was how much the kids said really people weren't listening to them. They didn't believe them. And really we need to have a bit of a think about that in terms of the services that we provide in the future and their voice in the solution. I want to finish by saying thank you to Kathy. I want to make sure I say thank you to Caroline, just in case I don't do it later today. And over back to you, Kathy.